My name's Dr. Emma Searle. I work at the Christie Hospital in Manchester, UK, which is Europe's largest single-site cancer centre. And my particular interest is in the early development of novel anti-cancer drugs for the treatment of hematological malignancies. And that consists of mainly acute myeloid leukemia and myeloma patients participating in the early phase trials. Obviously, there are some differences between European, UK, and US practice, but typically the reality for the majority of our acute myeloid leukemia patients is that they're not able to be cured currently. So treatment for patients who are fit enough to receive it consists of high-dose chemotherapy with or without a transplant, and really that treatment, there's been some drugs added in, but it's changed very little over a decade. And then the majority of our patients, though, are older, are not able to receive those intensive approaches. And for those patients, the standard of care is venetoclax and azacitidine, but nearly every patient that receives that treatment will ultimately relapse and require additional therapy. Yeah, so I'm delighted to have presented the latest data for the Bleximenib monotherapy study. And in this, the focus of the presentation at this ASH was really around announcing what we feel now is the correct dose to move forward with the further development of this agent. So in this study, patients were treated with a variety of different dosing regimens, with the dose escalating as high as 150 milligrams twice a day. Although there was efficacy and all of those doses were largely tolerable, ultimately the data points towards 100 milligrams twice a day being the right dose to move forward with this agent. Taking the dose up to 150 milligrams twice a day comes with very little additional efficacy and a little bit more in terms of side effects for the patient. So whether that's nausea or depression of blood count. And particularly when we're dealing with an older, frailer population, those sorts of considerations are very important. So this is a very tolerable drug compared to much of what we use in acute myeloid leukemia treatment. The side effects that are known to be a concern for all drugs in this class, for all menin inhibitors, are differentiation syndrome. So that is a class effect when we're targeting this pathway, in that one of the ways in which leukemia develops in patients, blast-like cells within the bone marrow are not able to mature into more mature blood forms, which is referred to as a differentiation block. And when we target that block using pharmaceutical agents like Bleximenib, you can suddenly remove that block. The cells can mature rapidly, and that can make patients unwell. So that's known to be an issue for all of these agents. It does occur with this agent as well. So mitigation steps were put in place during the course of the study to manage that risk, and they've been largely successful. There is about a 6% rate of differentiation of more serious, so grade 3 and above differentiation syndrome with this agent. The other side effects appear very manageable. There is concerns with some of the other menin inhibitors about ECG or EKG, as you'd call it in the States, abnormalities occurring with the agents. That's not something that was seen with this with Bleximenib, so that will make the day-to-day management of patients receiving this agent a bit more straightforward. And there is a little bit of myelosuppression, so reduction in blood counts that occurs with this agent. We've talked about the fact that the higher doses led to a bit more of that, and probably just not necessary. But the management of that bit of reduction in blood counts, was quite straightforward. It isn't a problem compared, when we compare some of the other agents that we use in this space. So the overall response rate in terms of CR and CRh rate was 35%, which it's always very difficult to draw comparisons between one early phase study and another, but certainly seems in the range of the response rates that we'd hope to see with this agent. And of course, further studies are planned. We're presenting combination data with this agent, along with intensive chemotherapy and venetoclax and azacitidine at this conference. This study, the CAMELOT-1 study, is now progressing into its phase 2 expansion, where we can get a clearer sense of the efficacy of this agent moving forward.